Yes, there are a variety of ways to treat varicose veins depending on the severity. Most private insurance carriers, including Medicare and Medicaid, cover treatments. And there are some out-of-pocket costs that the patient might be responsible for, which is your typical copay, coinsurance. Also, some insurance carriers do require prior authorization, but this is something that the office would handle prior to your appointment. No, we are very upfront with our patients regarding our fees. We do provide a cost estimation sheet, which outlines the estimated patient responsibility. And we do provide this prior to the procedure, so the patient will know going into it what the estimated responsibility would be. Yes, currently we offer payment plan options in addition to care credit, which patients can apply for. Feel free to ask about care credit or other financing options during your appointment if it's not mentioned to you. Make an appointment for a consult because you shouldn't suffer because you're avoiding getting care due to the costs. Again, most insurance carriers and Medicare and Medicaid will cover the treatment outside of the out-of-pocket costs that you'd be responsible for, but there are payment options available that we can offer to assist you with those out-of-pocket costs. So don't suffer. Come visit CVR.